Welcome, everyone. I'm so happy to be here today to talk about caregiving. My name is Vicky Leff. I'm a clinical social worker. I've been a social worker for about 35 years. I've worked in oncology, I've worked in palliative care, I've worked in hospice. I'm now the executive director of the Advanced Palliative and Hospice Social Work certification program. Just prior to that, though, I was at Duke Hospice, and before that, I was at Duke Palliative Care. So I have a particular interest, and I'm so happy to be here to talk about caregiving because I've worked in the serious illness care area for a very long time, and I have learned so much from family members and patients themselves about what it's like to get through an illness, whether it's something that someone recovers from or whether it's a chronic illness or if they don't survive an illness. So I hope that I'm not going to fix anything today at all. And the title is overwhelmed because when I think about what I've heard from caregivers and my own experiences, that's the word that seems to come to mind that really encompasses what it feels like to be a caregiver. While there are certainly, I'm sure, times that it feels very meaningful, rewarding, and all of those nice positive things, there's so many other times that it feels just overwhelming and feeling lost at sea. I have no answers for you, but I do want to share some of the things that I've learned along the way that maybe you've probably already thought of, but perhaps just a different way of thinking about how to get through this, because it is a day-to-day challenge, I have no doubt, and share just a couple of, I hope at the end of this, a couple of very small, what I call bite-sized strategies that might help during those days where you just want to throw up your hands and just kind of not sure where to go and what to do. I'm not using any slides today, but I'm going to apologize in advance for looking down at some of my notes sometimes because I want to make sure to cover a bunch of things. I guess that the one thing that I would really like to emphasize, and you probably already know this, but it's worth saying as many times as possible, and that is that as a caregiver, regardless of what you're dealing with, how many people are around you, who's helping you, or perhaps who's not helping you, this is really complicated and emotionally trying work. And I say work. Sometimes it's pleasurable, sometimes it's not. And my guess is that many of you, certainly what I've heard from folks, is that the different emotions that you have during this process are sometimes surprising, upsetting, or make you feel guilty. As an example, and I suppose that you would know this better than I, that lots of times folks have confided in me that they're really angry at being in a caregiver role. This is not what they signed up for. That, of course, they love and care for the person. That goes without saying. But that this is not what they expected. Obviously, no one expects an illness to come upon us. And certainly if something becomes chronic, it's really a whole new role for them. And so feeling maybe angry or resentful, maybe feeling upset that other folks in the family are not coming to help as much as you imagined, I think that we all might at times imagine, what would it be like if I had to care for my loved one? What would that look like? What would I do? Who would I call on? How would I react? And sometimes that involves, well, all my siblings would come and help me. And sometimes that doesn't happen. Sometimes it does. But that's a lot it's usually one person. There are, I want to say 126 million people who are acting as caregivers. 2/3 of those, if I have my statistics right, are women. And 250,000 are kids who are between the ages of 10 and 18 or 21. So this really runs the gamut. We've probably all done some caregiving in our lives. So I want to just acknowledge with you some of the things that you might already be feeling, to be able to normalize that for you. And please don't take my word for it. I'm not the be-all and end-all. But I do want to give you some context that lots of caregivers feel these very emotions that don't feel right or weren't expecting them. And I would like to invite you to think about how normal that really is in order to then give yourself some space, some opportunity to be kind to yourself, to know that it's okay to be angry or resentful or irritable. Of course it would. Think about what you would say to somebody if they were talking to you as a caregiver. And if we can do that, if we can normalize this a little bit, I think that what that might lead to is that you might create a little bit of space to think about, well, what can I do to get myself through this? The medical profession doesn't often ask you how you're doing. They focus on the person, the patient, and you're happy for that, perhaps, maybe not. I think we don't do a good job of asking the spouse, the partner, the brother, the sister, or whatever it is, how are you holding up? And 9 times out of 10, the answer that I've gotten from folks is, I don't know. I'm just getting through, and then the focus shifts back to the person who's sick, which I understand that. But, this is one can't exist without the other. And so I think that we need to do a bit better of job, or a lot better, of being really paying attention to what it's like to be a caregiver. For instance, I think lots of times folks underestimate the impact on their own health about what it's like. Maybe they're not sleeping as well, they're not in their usual routine. Maybe they're not able to exercise as much. They can't, they're doing something totally different now. And so their own health suffers. But I worry that they don't feel able, or that there's not really a space for them to be able to say to somebody, I'm feeling pretty bad myself. Because then what does that mean for the caregiving system? And what would that mean for the person who might be seriously ill? The other thing that I wanted to bring up that has been, that was a little surprising to me early in my career, and I think it might be surprising to some of you to think about, especially if you're working or you're helping someone who has changes in their thinking or their personality due to dementia or Parkinson's or some other cognitive impairment. And I think what I've heard from folks, and perhaps you'll resonate to this, is that they'll say, I feel like I've lost them already. But here they are. Maybe they even feel like someone different. Like, who is this person? They don't have control over some of their cognitive functions, and maybe they act differently. Their personality might shift a little bit. Someone with cognitive impairment over time might change, or, of course, lose memory and so forth. And so that relationship that you have and had with that person changes fundamentally. And yet there's no social construct to be able to deal with that. The person is there with you, and yet it feels like they're gone. So what do you do with that? Do you acknowledge that honestly with folks? Maybe that feels a little bit harsh, or they worry that they're going to be judged for thinking about what that might be like. So I invite you to think about those reactions, if you've had them, as an expression of grief. Grief is not always about someone who has died or is literally gone. I think that we've learned a lot about grief over time, that it's the loss of a lot of different things. And I think as a caregiver, there is no doubt in my mind that you have lost some things along the way, whether it's your role as the primary breadwinner, or you're the one that used to take care of 5 kids, or, what the companion, whatever it is, it's probably being challenged, and you're not sure whether you be able to get back to that role or not. But it's different. And in that regard, you've kind of lost something. And it doesn't feel like something that you can grieve. There's not a funeral for it. I don't mean to be crass, but there's no social way to express that without sometimes feeling pretty guilty about, oh my gosh, I shouldn't be thinking that. Of course, it's the same person, but things change. So I think understanding, or maybe putting the lens of this feels like grief, might give you some permission to kind of absorb that feeling and not feel guilty about it, kind of accept it and know that that's perfectly normal. It stinks to feel it, and there's no huge fix for it other than acknowledging that that's, of course, it's a loss. If you're an older couple and you were planning for retirement and doing, all of these wonderful things in retirement, and now you can't. By no fault of anybody, but where do those dreams go? Where does that loss go? And I think that sometimes our society puts so much focus on, well, you just got to focus on that person. I worry about you, thinking about what have you lost in this? And that, of course, the focus might need to be on that person and physically taking care of them, emotionally taking care of them. I just invite you to take a few moments once in a while to think about what this means to you, and how it might be impacting your own physical being, your emotional well-being. I think it's complicated, and I think it's kind of messy. So maybe even, sometimes folks find it helpful to write down what they're feeling. If it's not something you feel you can share with folks, it feels like, people aren't going to understand what this is like. And no one can really understand unless they're in your shoes. I wanted to share something that was really powerful for me in terms of how difficult caregiving can be, and how maybe as medical professionals, I'm not sure that I've always really appreciated the difficult nature of it. A friend of mine from college, so many, many years ago, over 40 years ago, an old friend of mine, was diagnosed with a brain tumor. And she slowly lost some cognitive abilities, and she's my age. So immediately, of course, I'm thinking, gosh, what if this happened to me? What would it be like? What would my partner do? And I had an occasion to talk to her husband, who I know well, who is a Vietnam vet, and had a hard time in Vietnam. Well, of course, anybody would have. Anyway, and so we're talking about it, and I'm not really sure what to say. I'm not really sure how to be helpful, other than just saying I'm thinking of you all, and I wish I could be there to help. It's during COVID, so that's not possible. And I said, so what has this been like for you? And he said, it's been worse than being in the war. And I was just so struck by that, and moved and heartbroken. And he, that went on to describe why it was so much harder. The unpredictability, not having a structure, not knowing what each day might bring, losing his wife at a time when they were going to retire and have, lots of fun together. But it was just a very powerful, I imagine maybe some of you, if you have similar experiences, might feel the same way. So I say that not to get us all depressed or anything, but to say that it makes sense to me that this would feel worse than war. It would make sense that you would have conflicting feelings about, I kind of feel guilty that I want this to end. I kind of feel guilty that I don't like this some days. I'm supposed to, be this phenomenal, loving caregiver. So I guess I say that to give you, I hope maybe, not that you have to do anything about it, some permission in a way to allow yourself to feel a lot of different things. The caregivers that I've spoken to, and perhaps you have this experience as well, feel a lot of things. So what can one do about that other than accepting that it's pretty normal to have, conflicting feelings and to be concerned and not have anywhere to put it? So what I would suggest, or one of the things I suggest, I know very much that when someone says to you, what can I do to help? You're like, I don't know. I don't know. Be the caregiver for the next year? I don't know, because there's so much to do and you're so overwhelmed. So a couple of things that perhaps you've heard before, and I think that have worked for caregivers that I've known and myself as well, is to think about things that you can do in a really bite-sized, small way. Meaning, it's easy to get overwhelmed with the entire situation, knowing that we can't fix it, probably. And you don't have a lot of control over that. So acknowledging that, as opposed to fighting it or telling yourself bad things about yourself that somehow you're not doing the best job, of course you are, and thinking about in the smallest possible way, what could you do tomorrow in a small way that might help you feel a little more in control, maybe get a little more help if that's something that you're looking for. How can you ask for that? And how can you, so I think just thinking about, instead of the big picture of, I wish I could just make this go away, or I wish I could fix this, let's make it a little bit smaller, because although that seems trite, in my experience across the board, that even if it's a few minutes a day, 5 minutes, 15 minutes out of 24 hours, that maybe you give yourself permission to go for that walk, to have a cup of tea, to talk to a friend about a movie, to do something not related to caregiving. Even that 5, 10, 15 minutes gives your mind and spirit a space to feel things in a different way. Does it fix anything? Of course not. Might it give you an opportunity to feel like, okay, I'm doing okay. I can do this. Or maybe it even gives you an opportunity to think about, what could I be doing differently? I'm so mad that my brother won't come and help me, but I'm so caught up in the anger I can't figure out how to untangle that. So maybe taking 5 or 10 minutes of a day aside just for yourself to go out, walk to the corner and think about, what might I be able to ask them to do specifically? Maybe they can make some calls. Maybe they can do some legwork on some medications or some equipment that needs to be gotten. So just to give your mind that space to be able to even think beyond, what do I do in the next moment of caregiving, I think it's worth doing. So I would encourage and invite you to think about what could you do for 15 minutes a day. So 15 minutes sounds like nothing. It's a lot. When your day is filled as a caregiver and every moment you're needing to do something, it's really hard to carve that out. But I would encourage you to do so, because it's just a small amount. And while it might not feel like it doesn't get to the big issues per se, it might give you a chance to think about, so maybe I need to be more specific when folks ask me what they can do to help, because I don't even know. So maybe I'll start writing down, I do find it hard to go to the grocery store. Maybe someone would be willing to do that for me. It's a small thing, but if you put yourself on the other side of that request, when you've tried to reach out to somebody to help them, I always find it's so fantastic when someone gives me a concrete thing to do, as opposed to, I don't know. I'm like, well, I don't know either. So, but if someone tells you, well, you know what? If I give you a grocery list, would you mind just going to the store and getting that for me? Yeah, of course I would love to do that. It's one less thing. It doesn't fix the big picture, but it allows you to share some of that burden if it's feeling that way at the moment. So I would encourage you to think about that if you have not already, and know that it's perfectly okay to have 15 minutes for yourself a day. If you can have more, great. You may not, though. And if 15 minutes is too much because of your schedule or what what you're needing to do for the person that you're caring for, then do 5 minutes. Truly. Make it as small as possible. There's some interventions out there. One's called motivational interviewing, and it's focused on figuring out what are you motivated to do yourself. Not what I want you to do. I would love all caregivers to have a spa day, or to be spelled for 2 weeks and be able to go wherever they want. That would be fantastic. But that's not necessarily what you want. I hear a lot from folks that they don't want to leave. They need to be there emotionally. So if finding something that makes sense to you, for me, it might be going for a really quick walk for 15 minutes. That may or may not work for you. So you decide what would be helpful and feel like a little bit of breathing room. I know that folks have probably said to you, no, you should do some mindfulness, you should do some journaling, you should go to a caregiver support group, you should take a day for yourself, and all of those may or may not work for you. I would suggest that maybe don't assume that you can do those things, and pick what is actually feeling reasonable and build on that success. And that's the reason that I suggest making this as small as possible, is to think about, you don't want to set yourself up for, I took an afternoon off and look what happened. They fell. Or something happened, and so of course you can't ever do that again. And while I'm sure that does happen, maybe bringing it down to a smaller bite-sized piece that feels manageable and successful, that you can do, might help you feel a little bit more productive and better about what's going on. So I think acknowledging the difficulty that you're going through and not assuming that somehow we all took a course in caregiving and we got it. We had to take a course to learn how to drive. We don't naturally know how to do that. And there isn't a course on caregiving. There kind of is. There are workshops. The problem is that by the time you need the workshop, you don't have time to go. And you probably have no energy to spend on that. And it probably feels like, I can't spend this time on me. I've got to focus on the person who's ill. I've got to take care of them. So I get that. And if you do have time to do a workshop or to go out to a movie or go away for a week because someone can come and spell you, I highly recommend it, and do it without guilt, and know that you're doing the best that you can. It comes down to that very old, I guess it still goes on, and if any of us have been on airplanes recently, is to put your mask on first, right? And it sounds so simple, and I suspect that you might be rolling your eyes as I say that, because that's the reaction I've gotten from caregivers to whom I say, you have to take care of yourself first in order to take really good care of this person. I imagine that you might be thinking, well, I know that, but I have no emotional energy to be able to do that, and I wouldn't even know where to start. So I understand and I get it. I know that you probably know in your head why it's important to take care of yourself so that you can be that caretaker that you want to be for as long as you want to be that. So I guess I'm encouraging you to reduce your expectations of yourself a little bit and to think about what can I do tomorrow on a very small level, even if it's just having a cup of tea by yourself for 3 minutes. Mission accomplished. Great. You got a few minutes by yourself. It doesn't take anything away. It doesn't make it any necessarily better, but it is soothing yourself. And I think that that's a really important thing that we can do when we're dealing with caregiving on a long-term basis or even short-term. And not, again, I just want to emphasize not underestimating those feelings that you might be feeling that feel really crummy might actually be grief. And as we know now certainly that grief does not happen in stages. It's quite cyclical. It goes up and down like waves and tsunamis. So feeling grief for someone and the loss of your role, of some dreams that you might have had that are now not going to come to fruition, loss of a personality of somebody that you're caring for, all of those things are really serious losses. And it's okay, I know you know this, but I'm going to tell it again, it's okay that that's not okay to you, you know? And that you can treat it as grief and loss in the sense that, of course, you're entitled to feel that sadness. And then maybe you're not having less negative self-talk. I hear a lot of that from caregivers as well. I'm not doing a good enough job. I could be doing this differently somehow. And I suspect that all of you are doing exactly what you need to do and doing it the very best way that you know how. And the suggestions today are, number one, to be kind to yourself and know that the range of emotions that you're feeling are perfectly normal. There really is no playbook or blueprint for this. I wish that there was, and that we could follow steps 1 through 5 and then everything's fine. But it's messy and it's complicated. And it's very emotionally taxing. So I encourage you to, when you can, to really get as granular as possible with what you think might be helpful. As small as you can possibly make it so that it can be successful. I hope that this has been useful. I appreciate very much that you are taking the time right now to come to a session to think about this, because that in itself is, of course, self-care. And so I applaud you for finding or making the time to be able to come today and listen to some other folks and kind of bat around some ideas that might be helpful going forward, and giving yourself some permission to take that time for yourselves. You do need it. Everyone does. It's just a lot easier said than done. I appreciate the opportunity to be able to share my experience with you all over the years, and I have learned so much from the folks that I've worked with, families, caregivers. We have a long way to go as a medical profession and as social workers. We need to do a much better job checking in and saying, who's supporting you? Is that something that you've talked about? Is there someone that can support you? Because your well-being is equally important. I'm going to finish up with that and say that I hope that this is useful. I hope you go to some other sessions. I hope that you can be kind to yourself and give yourself permission to have bad days. It's okay not to be okay. And then when you can, think about small things that people can do to help you. I know it's really hard to ask for help. I'm terrible at it myself. But you know, people want to help. It helps them feel better, so do it for them. It'll help them feel better knowing that they're helping you. And I wish you all well and hope that things go well in the future. And thanks again for tuning in. Appreciate your time.